Oh, good morning, everybody. Welcome to Impact and Coffee this morning on May 5th, our first one of May. I can't believe it. Oh, look, Claudia Medina is here. Awesome. So I'm Robert Nelson. I'm the program manager for the Grants Collective and the co-host for Impact and Coffee, which is held the first three Tuesdays of the month. And my co-host is Mariah Harrison.
Morning.
Who is now over at the city of Albuquerque, but she doesn't start till next Monday. Tell us what you do again, Mariah.
I'm in limbo right now, and then next week I'll begin as the Nonprofit Philanthropy Coordinator.
That's awesome.
Under the Office of Family and Community Services. Yeah.
Cool. That is, congratulations again, Mariah. You're going to be a really great asset to the city of Albuquerque. We really look forward to you working with us over here and in the sector all over the place. So just want to recognize the rest of our volunteer teams. So Erin Hilkema over at the Grand Plan. She's one of our volunteers. Destiny Logan over at Global Ties ABQ, and then Michael Green over at CNN. Well, not at CNN Ingenuity. He's over at the New Mexico Farmers Marketing Association. So thanks, Michael, for all your help. Our other teammates, Jamie Chester, I don't think is here this morning, but I know she's busy doing amazing things elsewhere. And then Juana Beta, who is a consultant with the Red. He's up north, I believe, this morning. So good morning again. So today is a very special day. It is Giving Tuesday, if anyone knows about Giving Tuesday. There's a very special Giving Tuesday event being held nationwide or globally, actually, if I'm understanding that correctly. So if you have a favorite nonprofit out there that is doing a Giving Tuesday event, or you just feel like supporting a nonprofit on this day, check out Facebook or any of their other social media like Instagram or anything like that, and people will have their links to get support today. So whether it's volunteers or donations, take a look. I know a few organizations that I am associated with, like Asian American Association and Young Nonprofit Professionals Network National, are doing Giving Tuesday campaigns, so check it out when you can. We see a lot of familiar faces on the call today. We also see a lot of new folks. And so utilize the chat function if you can to share your cards, share your information, your organization. Just a little housekeeping. Everyone is on mute this morning, so just because we don't want a lot of cross chatter. However, we might have a very interesting kind of way that we're facilitating this morning, so we'll get here into that just really quickly. Today is Giving, also Gratitude Tuesday. So Mariah, is there anything that you're grateful for? It's on mute. Okay.
I was mentioning that I'm really grateful to have an entire week to myself between jobs to organize my life, do my taxes, and tear up my front yard.
That's awesome.
I agree.
Agreed.
How about you? Or anybody else too. Feel free if you have anything to share as we're talking for Gratitude Tuesday and an ongoing thing. Type it into the chat and we'll highlight it and get to read about it too.
Okay. That's really helpful. So on the call today, we have a very special conversation today. However, I know that due to some scheduling and timing and everything like that, some folks were not able to make it. But I do know that Claudia Medina is here today. Claudia, if you could, I don't know if your camera's on. Let me see if I can find you in the thing.
And we've also got Michelle.
And Michelle is here today too. Great. So, hello, Michelle. So what we're gonna do is pass it over to you really quickly after we do some brief. Actually, I'm not sure. I think we've got all of our housekeeping. Thanks, Mariah. What we're gonna do is just host a little panel conversation, a roundtable conversation with Claudia and Michelle on domestic violence and what we're seeing from the pandemic today. It's a very special conversation. I think it's something that we haven't had yet, but I know that we wanted to raise it up specifically. So, so with that, I think we can go to introductions. And as you're doing introductions, Claudia and Michelle, if you could just take about 3 minutes to talk about yourselves and your organization, and then we'll get started with questions.
Okay.
And so with that, I will throw it over to you, Claudia, to introduce yourself.
Okay. Good morning, Robert. Good morning, everyone. I'm Claudia Medina. I'm the Executive Director of Enlace Comunitario, Enlace Comunitario, if you don't know about us, we are a nonprofit that has been in Albuquerque for the last almost 20 years. In 2 months would be 20 years actually that we open our doors. We were created with a double mission. One, to decrease domestic violence, try to eliminate domestic violence among Latino immigrants in New Mexico. And two, to advocate for the rights of women, children, and especially immigrants in the state. So we provide direct services to our community in issues related to domestic violence, but we also do a lot of public policy advocacy around the state and nationally. In terms of services, we provide counseling, case management, we provide legal assistance, we have a transitional housing program, we have life skills classes. We work very, very close to the primary victim, but also to her children. And I said her because most of our customers or clients or consumers are women. 95% of the people we serve are women, even though there are some men that are victims of domestic violence. We have very few every year that we see as victims. We don't see perpetrators of abuse. We don't have the capacity to do that in a very safe environment. So we decided a while back to do more work with men as allies to prevent domestic violence. So we work with men, but in a different capacity. I'm very eager to have this conversation with all of you, and I look forward to a very interactive dialogue. Hopefully, you guys have great questions so that we can have a meaningful conversation.
Thank you, Claudia. I really appreciate it. And I'm honored that you're here today. I know that you are a tremendous leader in our community. Michele, could you take some time to introduce yourself, please? Oh, I hope Michelle's not on mute.
How's that? Better?
Better, all right.
Okay, sorry. I just, real quick, my name is Michele Tafoya. I just want to apologize. I have a new puppy and she's squeaking in the back. So I hope that, don't worry about that. So my name is Michele Tafoya. I am the existing clinical director for the counseling department at the Domestic Violence Resource Center. I am also the director of education and community outreach, which is a new program that we started over the past year. DVRC has been around since the late 90s and has been, a resource specifically for domestic violence victims. We currently offer 4 different types of services. We definitely do our advocacy. Our advocate department has changed quite a bit within the past few years. We've had a lot of transition over the past couple of years, and we feel like we're finally at a place where we're leveling out. But our advocacy department specifically has gone through quite a few changes. We still have field advocates that are able to go to a scene and work with the client individually, help them get safe, and work on any paperwork that might need to be done for a restraining order, get access to a judge for an emergency restraining order immediately, things like that. We have our in-office advocates that are able to do the same thing, but also provide direct resources to the community for legal services. We work directly with SANE, CYFD, Rape Crisis, a lot of those different organizations. We've recently added what's called an embedded advocate. And it's something that we really are finding that is beneficial, and we really want to expand. But an embedded advocate essentially is somebody who is on scene or directly on call for a specific location. And by that, we mean we currently have one in the 2nd Judicial Court, the DA's office, And we have current MOUs that we're working between Presbyterian and UNMH. We're also working with the School of Medicine at the University of New Mexico to try to work with residents. And all of this is to provide education specifically for domestic violence, and also to make sure that we are like right there when they recognize the domestic violence scenario, and we're able to be with the client immediately. So it's a program that we're very proud of, and we're really, really trying to expand it as much as possible. Like Enlace, who we refer people to frequently, we love their services, and I can't give enough props to Enlace. Thank you so much. We also have case managers that are able to work with clients to do specific needs assessments and figure out exactly what they need to navigate breaking the cycle, what resources they need. We know that the majority of domestic violence victims are women, and the majority of them do leave a relationship and they are destitute. And so our case management program is constantly building programs that we want to create empowerment and independence for, not only for the mother, but for children that they have under them as well. And we also, we've also seen a spike in male clients over the past year, which we just feel that they're more comfortable to be able to talk, which we'll take any day. We have a counseling program that our clients can see a counselor for anywhere between 6 months to a year. Definitely case-by-case basis, but if they need to go longer than a year, we'll work with them. Our primary goals are to break the cycle of violence, build independence, build self-esteem, and then work towards healthy relationships. When we have clients come through our system and utilize our services in the full bandwidth, we generally see an 88 to 92% success rate. And we base that off of breaking the cycle, not returning to domestic violence relationships, having healthier relationships, not only intimate ones, but with their families, teaching kids communication skills, teaching parents communication skills, learning how to be a parent on top of having domestic violence in their past. All of those things are things that we work with. We do work with anybody from the age of 5 till the end of life in counseling. And we utilize very empirically studied modalities. Most of us are CBT. All of us are required to be EMDR trained now. So it's a modality that we really believe in to help with trauma. Finally, our fourth program, which one is one that I directly head up, is the education one. And again, I am working specifically with mostly schools, but medical professionals, mental health professionals. There are a lot of community meetings that I go to and trainings that I run to bring DV awareness to the table. And we did not feel that it's right to truly call yourself a domestic violence resource center if you're not impacting the community and trying to spread the word. So we're hoping that program expands more. It got a little shut down with the COVID stuff, but we still have a lot of partners out there that are requesting our trainings and stuff like that. So that door is open to anybody here as well. So thank you. Thank you for the time today.
We really appreciate it. And we appreciate that you're on today to talk a lot about your work and the work around our community. Our last panelist is Stacey Alvarado. Welcome, Stacey. Good morning. So we're taking about 3 minutes to introduce yourself and your organization, please.
Hello, my name is Stacey Alvarado. I'm from PB&J Family Services. I work in our parenting program department. I'm the program manager.
Thank you, Stacey. Could you talk a little bit about what PB&J does, just really quickly?
Yes, so we are a at-risk child abuse prevention agency. So we work with the parents, the children, to prevent child abuse. We have multiple programs within our agency. We have pre-K program. We have our parenting program, which is birth to the age of 5. We have a home visiting department, prenatal to the age of 3. We have a CBPIR program. That's a community-based program working with CYFD and reunification. We also have a family infantile program, 6 weeks to the age of 3. All of our programs kind of line up in the same capacity of how we operate. We go in the home, we assess, the family, either with the child to see where they're at with developmental milestones. We provide a lot of case management throughout the entire agency with our programs. Some programs have more intense case management. Some not as intense. And then we also, within our parenting program, we provide 16-week parenting groups. And on a normal day without the COVID, we operate 2.5-hour groups for the 16 weeks. Parents, children are able to attend. 1 hour is with the children in a group, the other hours with parents in a group. Then they come back together for interactive activity. And then through there, we provide home visits case by case with families. So a lot of it is pretty, a lot of our services are in the home, in the community, but we also have some services, some programs that provide more of the services in the home. And that's about it with our program or our agency.
Really appreciate it. And welcome to Unpacking Coffee this morning. We really appreciate your presence today. So yeah, why don't we dive into questions? So a lot of you have highlighted some of the things that you're doing currently, and then post-COVID. Well, post-COVID, we're still in it. But I think the first question we're going to ask is, it's been a challenging time for a lot of organizations out there. Could you talk about your what has changed for your organization and what challenges have you faced? And Michele, since you were talking a little bit about what we used to do, what you all used to do in normal times, like could you address that question first, please?
Yeah. So our executive director, he's been taking care of his elderly father, and so when this started really hitting, we started having conversations in early March about when we were going to close, and all of us were kind of like, well, what are you talking about? So he actually had all of our organization shut down, I think a little bit earlier than most, because he was afraid of getting it and giving it to his father. What that taught us was you just quickly put technology to its limits. And we have had to figure out, like we started doing a lot of the counseling, case management, and screening over the phone. We weren't using Zoom yet, but we started doing a lot of that over the phone and just really trying to bumble through it. As the clinical director for the counseling department, due to the fact that like most of my license is like the one that is the umbrella for our counseling department, I'm the only one doing assessments, and that's because we have to have specific paperwork signed and all of that. Even with HIPAA regulations, it's a liability. So understanding how to communicate that to people, making sure that they had different options to be able to get that paperwork back to us. When a lot of the HIPAA regulations started to kind of be a little bit laxed for this situation, we adopted online telecounseling, which we had never done before. And just bumbling through that, trying to figure out how to make sure to get clients on with you and how to get, everybody on the same page in meetings and things like that. So our biggest technology and bandwidth and just bumbling through how this all works. I will say as a counselor, it becomes a little bit more impersonal. So one of the challenges that my counselors and I have had is, human connection is really important when you're in the room with a client, and having the ability to not read body language, to not look at different things and things like that. There's a lot lost in translation. And figuring out new ways to communicate with people in order to say, hey, you know what, I can't see you, you can't see me, I heard this a little bit differently, things like that. It has definitely made us step up and really think about our technology in office. We're going to hopefully be doing some upgrades to all of our systems and make it so that it is 10 times more robust and more available for people, not only directly through the lines and over the internet, but also directly through our website. We want to start creating ways for clients to chat with us 24/7 and to also do their paperwork online with digital signatures. And so we're working to do that, to make the process a little bit more streamlined, because COVID will be with us for a while and not everybody's going to be comfortable in coming into the office. We want to make sure that we capture all of our clients that do not have those options. So it's definitely a work in progress, and we've had a lot of growing pains, but we're all kind of on balanced ground right now. So I hope that answers your question.
Yes, it does, and I appreciate that you would share. I think what you've experienced as an organization is what a lot of folks do. I think, but I think every experience is different, and so which is why we're doing this kind of panel this morning. Stacey, how has your organization changed, or what challenges have you faced?
So with us, when we first went into COVID, again, we're used to doing our parenting classes on site, our visits in the home, So I guess at first, like when we first started with the COVID, everybody just switched to like phone calls and okay, like no more groups. There was no more pre-K to, all right, we got to get a better system because it doesn't look like we're going to get back together. So eventually everybody switched to do Zooms. Our groups are held via Zoom right now, which actually it's been going good for us. But at first parents were like, what? When we started saying, okay, well, do you guys have the WhatsApp or do you guys have a Zoom link? Let's get you guys set up. Let's do our visits through that way so we can provide support. Our parents were a little bit skeptical about it. They were like, no, this isn't right. Can you guys just come? We're like, wait, not yet. You know, we have to follow this process first during this time. But I feel like as time went on and staff didn't let up on providing the services to the families, I feel like the families are able to engage more. I was just looking like at our productivity for our families for the month of April, and I see that more families are engaging in services, and even our referrals streamlined across all of PB&J. I feel like everybody wasn't sure to do telehealth services, paperwork, they weren't sure of it. We've really, like I said, had to have switched over to the telehealth. So we have everybody's email, so I can scan email everything that we're doing on paperwork so that the families have every paperwork that we're doing, because before they would be able to visually see all the paperwork and know exactly what we're filling out. Now we're just reading off something to them, and they're we're hoping that they trust us. So we're like, well, let's email it to you guys. And I feel like that's been very good. Staff have, some of our teams, we have new staff. So just really working with our new staff to get with, the switch of the telehealth has been, quite a challenge too. And then I think of our devices, all of our equipment, our network, all of our staff have smartphones, which has been really good for us because they've been able to use their smartphone. But then when we have some days where people are working from home, not everybody in our program has laptops. So I kind of feel like that's been a barrier for us and a little bit of a challenge, just to get everybody set up with laptops so that they're able to work from home properly and accordingly. But so far, our families have responded good. It just took us a minute to get really a good system and how we were going to provide services, even for our pre-K families. The teachers are doing Zoom. They're doing Zoom, circle time. So the teachers get on there and provide different activities for circle time. They send homework home, but it took them a little while to adjust. And it really took for the families to be okay with that type of supports to continue the education for their children. And all of our programs. So yeah, I mean, that's kind of what we face across the board, challenges that we see. We worry about some of the kids that are in the homes. Of course, we want to make sure that we're providing healthy activities, because we are, again, a child abuse prevention agency. So we want to make sure that we're recognizing stressors that families face, whether it's loss of employment, lack of food, their kids are home, they have developmental milestones that sometimes parents just aren't aware of. So just making sure that we're educating our families and really providing that support to them. I hope that was an answer to the question.
Absolutely. I think that highlights a lot of what we're trying to understand more about what other nonprofit stories are talking about during the pandemic. Lastly, certainly not least, Claudia, could you talk a little about how your organization has changed during the pandemic, and any challenges you may have faced?
Yeah, as Michele and Stacey mentioned, our staff is all working from home. We started that in March 13, and we had to adjust as well to the technology part of working from afar. Especially when you work with victims of domestic violence, it is very important to protect confidentiality. So we had to make sure that our conversations with clients were totally protected. We don't use Zoom, we use something more technologically confidential, which is Ring Central. So we had to do a lot of things, buy laptops for the staff. We are 8 members in this team, and just dealing with the phones and the laptops and all that was at the beginning a challenge. But what was more challenging was making sure that everyone that we have served in the past knew that we were available to them, that we were open. There has been a lot of misinformation about COVID-19 in Spanish. So let me get back for a second. Most of our clients, as I said before, are immigrants, but most of them are undocumented immigrants. And as you know, undocumented immigrants didn't qualify for the unemployment, don't qualify for the stimulus monies. Most of our clients work in the service sector, so many of them lost their jobs. And the perpetrator of abuse is living in the same home with the victim, and chances are he also lost his job. So the the volatility of the domestic violence is higher. The safety issues are very concerning to us, so we needed to talk to all of our current clients to see if they were safe at home, and also to offer them information about COVID-19. What was this? Because many of the press conference, many of the websites dealing with the issue were in English only. So we also had to advocate at a local and national level to make sure that language access was taken care of. And at the same time, again, we started making sure that our families had the basic needs met. And so we had to reach out to all of our donors and funders to see if we could get a fund to provide cash assistance and rental assistance. I have to say that in the last month and a half, we have been able to disburse close to $100,000 in aid, direct cash assistance or rental assistance to our families. That has consumed most of our time, making sure that this connection with the families we serve was meaningful to them, that we focus on providing the current services, meaning the counseling and the legal assistance, etc., but at the same time that we were mindful of the more pressing and immediate needs that our families had. So that has consumed an amazing amount of time from our advocates. Our case managers have done an amazing work. We also have former clients that we train as community health workers or promotoras who have been calling not only current clients, but families in the community that we reach through our prevention efforts. We also, so that the community knows that we are open. We work with United Way to make sure, and the city of Albuquerque to make sure that the phone number at the Family Advocacy Center was answered and that the phone had a message in Spanish because it didn't have so that families could know that if they were Spanish speakers, they can immediately reach out to us. So it has been lots of efforts to make sure that the community knows we are open, that the current clients are safe, that they are all connected with financial assistance, and that the staff is well taken care of as well. We didn't lay off anyone. Everybody is working. We connect weekly so that I can check that they are in good spirit or not. Our team is a fantastic, fantastic team. And everybody I have to say, everybody is working full speed to make sure that we help as many victims as we can.
Thank you, Claudia. I appreciate it. I'm going to toss it over to Mariah to ask our next question.
Thank you, Robert. Thank you, Claudia. So our next question is a two-part question, and I want to make sure that I get this right. So first I'm going to ask Michele to answer this question. So what we're wondering is that we've seen so many funders step up to provide some emergency funding to our nonprofit organizations, and we're wondering, have you been applying to any of these grants? And also, within this experience, are you seeing ways that maybe funders could be more responsive to community needs? Michele, go ahead.
The pulse of those. I want to say, I'm going to give an estimate because I can't remember all of the ones that he's applied for, but I think he's gone for like 5 or 6 so far. And I do believe that we received some, I don't remember exactly from who, it might have been, I don't remember who, United Way maybe, but anyway, the biggest thing that we're trying to do during this time to make sure that those funds are used smartly is making sure that it's going towards our technology to make sure that our reach is easy for our clients, that we're available, and that we're keeping our promise that we're staying open. But I think that one of the things that we've run into, and I'm just going to say this in general, like with some of the big, well, any grants really, I'm just going to say it. I don't believe that when we go through the process and we really put everything that we do into these grants, I sometimes think that what we do is lost in translation to whoever is on the other side of them. And I'm not saying for this panel, but in general. And it's confusing because it seems like for some of the bigger, either government or private community grants, it seems like the focus is generally to what they call the mental health umbrella, right? Where we're focusing on depression, anxiety, and substance use. And I don't think people understand, we don't think people understand that actually there's this undercurrent of dysfunction that creates all of that stuff. And DVRC, when we're working with our clients, we don't touch the surface stuff. That's fuzz. We get to the undercurrent. That's the only way that you can truly break the cycle and change habits moving forward. And I think that some of that is lost in translation in grants. And it's something that we've seen over and over again with multiple grants. It doesn't matter if they're $5,000 or we're trying to go for ones that are like $1 million. It just doesn't, it seems like the focus of the community is on these big major things and nobody realizes that there's a source to it. And they're looking at putting out fires, not trying to address the actual source. That's one of the biggest things that we see. I don't know what that means for funders or who reads them, but it's a big one. And again, that's something that part of our education program is trying to help people understand, if that makes sense.
Yeah, it does. Thank you.
Mm-hmm.
And so to add on to this, Claudia, when I ask you to respond to this in what kind of applications you've applied for, if any, and what your experience has been, and how funders can better respond in some ways. There's another piece of this question that we're wondering, are there limitations on funding preventing it from going to organizations that serve undocumented or mixed status families? And
Yeah.
Claudia, I'm sorry, Michele, right after Claudia's done, if you have something to add in reference to that, I want to be sure you're able to, but Claudia, please do.
Okay, so funding for undocumented families. I have to say that our experience with funders has been quite positive. We have had large foundations. For instance, the Kellogg Foundation allow us to make our grant be used for operations instead of a program in particular, which has made a tremendous difference to us. The city of Albuquerque, for instance, just issue a request for proposals to help families, to provide direct assistance to families regardless of their immigration status, which is refreshing to me. I think that we haven't gotten the money yet. We are applying for those dollars, but just the intention and being mindful that immigrant families and undocumented families are being impacted tremendously by this speaks volumes about the sensibility of the city towards this issue. And that sensibility has grown because many pro-immigrant groups have been advocating to the city to provide these additional dollars, but they have been very eager to listen to us and have helped us tremendously. We also, as I said before, a group, we got monies from funders to provide direct assistance through especially a national level collaborative of funders called FII, Family Independence Initiative, that has raised, as of today, more than $44 million at the national level to provide direct cash assistance to families, to the poorest families, the most underserved families in the country. And here in New Mexico, they are helping pro-immigrant groups, especially in the city of Albuquerque, and our enlace, they provided $75,000 just to provide direct cash assistance. We have been working with the state as well to make us, to allow us, the state and the federal government, to allow us to, for them to be more flexible about timing issues. We get the funding from the state and the federal government is reimbursement based. So meaning we have to do certain number of units of services in order for us to get the money after we provide the services. And some of the services are hard to provide right now, like support groups are not something that can be done easily in these COVID-19 times. And so we have to negotiate with them and see if they could be more flexible with the type of units of services that we can be reimbursed for. And we are still working with some of them, and some of them have been flexible and some of them have been less flexible. But in general, I have to say that many funders are being open to the reality that we are facing and are trying to be flexible.
Good, that's good news. You have a number of solid partnerships there. I appreciate that. Michele, do you have anything to add before I give Stacey the floor?
No, I think she hit a lot of what I was going to say on the head. I mean, I think that definitely like I'm thinking specifically case management here. It seems like some of the older restrictions that were keeping our clients that are not from the U.S. that were keeping them from getting services, some of those have been lifted over time, and it's a little bit easier. Our case managers are really good about finding programs that can help with. So, but it was an amazing question because it's so important, especially here. So, no, she touched on pretty much like everything I would have said except for the funders, but yeah.
Okay, great. Stacey, please tell us what your experience has been. What have you applied for, and how can they be more responsive, etc.?
We've applied for several different stuff. I think a lot of the funding that we've applied for is really to get computers for our staff so we can provide supports to our families. I know that there's a few other grants that our grant writer and our associate director and executive director are working on. I'm just not too sure exactly all of them. They'll just send, our grant writer will send us like emails like, hey, do you have a story that I can share? I'm writing for a grant for more case management funds. Or the program that I manage is our Bernalillo County contract, and we have funds already set aside for immigrant families, and so we're just trying to put a plan in place with the county and within like our leadership team of how we're going to utilize those funds. So we're very lucky that within one of the programs we have the funds for immigrant families. We just got to really see how we use those funds. As far as I know so far from the feedback I get in our management meeting is that grant writers are responding. They're just wanting a little bit more information, and we've gotten approved for more of the case management side of the funding. So that's been really good. We're trying to see within like what kind of funds we can get to help families with food, the essential needs that they need. Some families just don't have, they already struggle now and just don't have means to continue to support their families. So we're really looking to see how we can get funding for providing those types of services to the families. So, I mean, on our end, everything seems to be looking okay. We haven't had anybody really give us any type of kickback. They're still wanting to get funding for us. And so we've been very lucky that we have these opportunities that come up.
I'm glad to hear that. And I'm glad to hear your grant writers are busy at work.
Yeah,
So,
us too. It makes it nice for me to know that we still are able to provide to our families that are in need. So it's nice when we get the emails and they're working on different stuff. It's really been a breath of fresh air because in this time, you know, we don't want to leave a family without services. And so if there's going to still be funding for us, I'm very grateful and fortunate that there's funding. We just have to figure out how to get it and how we're going to utilize it within.
Right. Yeah, a lot of decisions to be made, I'm sure.
Definitely.
So I think we have about time for one more question. So I'll kick it over to Robert. And first I'll just say, remember everybody, please utilize the chat to ask questions, but also now's a good time to start typing in any community announcements or resources that you have either in relation to this topic or otherwise. And while Robert is asking his question, I'm going to take a screenshot of our participants and remind you that we'll post a link to this when this is over. Robert.
Thanks, Mariah. That was a really great question, that last one. I really appreciate a lot of the answers from there. This last question, though, is kind of also a compound question. So we see a lot, we hear a lot, but I think a lot of cases of domestic violence and child abuse often go unseen. And so our question is, how can our community raise awareness and continue to lift up your work in our communities? And then two, what would you advocate for most strongly from policymakers locally and nationally? And we'll start with Michele.
I think we get a lot of responses from people in October. I saw this with the education program being kicked off last year. And so we had presentations and stuff all throughout the year. And then like September 15th, everybody started calling. Can you come and talk to us? It's Domestic Violence Awareness Month, stuff like that, which was amazing. It was totally cool. Like I had to get a new pair of shoes. I was like super like busy, right? However, I think that keeping domestic violence in people in front, like not, it doesn't have to be thrown in people's faces every single day, but it's an epidemic here in New Mexico. We tend to run higher than national average. There are lots of reasons for that, but I think that keeping the message visible for people is super important. And I think that we're really good at coming together and saying, woohoo, we have a month of this, let's fix the problem in 1 month, and then it kind of disperses out. I think that having more people that are around the state, the city, right, saying, hey, no, guys, it's not just October. This is an ongoing problem, and our kids specifically are really affected by this, right? When I do presentations, I talk a lot about like how before COVID was going on, there was a lot of stuff in the news about child offenders. And I remember seeing all of this stuff about like, oh my God, like their first thing is murder. Like they go into the jail right away for their first offense. And in our heads, we're going, well, yeah, let's look at the family. Let's look at the family dynamics. What's going on there? These are learned behaviors, right? And I think that if the education, the prevention, and the ideas that domestic violence is not normal, it is not something that should be continued generation to generation. And it should be something that we're having conversations about not only in the community, but at school, in families, and things like that. I think that if we kept the message visible for more than just the month of October, that we would actually maybe start seeing like changes over time. That and just making sure that people understand that there are resources available. Most of the people that come into our office, they talk to us and they're like, I didn't even know you guys existed. I didn't know that Safe House existed. I didn't know any of this existed because I've never been through this situation before, or it was so normal I didn't even know I was going through domestic violence. And then when you start talking to them a little bit and going through some of the education, I find that if that message had been out there really young, that maybe it wouldn't be such a big problem. So I think that keeping the message, like really keeping the foot on the accelerator for this and keeping the message out there would be probably one of the most important things that all of us can do as a state, and saying it's not normal, it's not okay, and there's help for it. I think that's probably the biggest thing that we can do.
Thank you, Michele. I'm going to toss it over to Stacey. Could you talk a little bit about how can we raise awareness and lift up your work, and what would you most strongly advocate for from policymakers locally and nationally?
Thank you. So I kind of like how Michele said, just bringing awareness to people. We set up a lot. We have an outreach committee that we go to, and we try to sit in on as many opportunities as we can to speak to different people and just bring awareness. It's so important, and I feel like people just it goes unheard with like the type of services that people provide and how some of our programs are here for people. I know I've connected with different shelters just to talk a little bit about what services we do, but then people just don't feel comfortable. I just feel like it's very hard, and it's a fine line of how people are going to feel supported with the type of services or trust anybody, because they've already have such a broken trust relationship with others that it's difficult. But if everybody in the community can just continue to provide those services and educate, and again, it does start in the schools, having teachers be aware of the children's behavior, to the parents' behavior when they have teacher conferences, to doctor offices being aware of those things, and knowing what services are out there for people, I feel is helpful. There's a lot of people that I've connected with throughout my time working here at PB&J that they're not too sure of what services are out there for families. So just really, really putting together something good on a regular basis, not just whenever it's domestic violence awareness, but on a regular basis of what type of services that are out there for families, so that they know and they can properly assess and feel comfortable assessing the family needs and sending out referrals and talking to the family of like what they need. I just feel like it's something that should be ongoing and that we should be aware of, not just on certain times. I think it's like an ongoing thing. How we put that together, I guess it would take a team of people from different organizations to come together to meet and really put like a solid plan in place that's effective. And then if it's not effective, do check-ins, like how can we make it more effective? No, that's just kind of like how I see things on this side of the work, within our organization. And I try to make sure that my staff are balanced with training so that they are able to recognize signs and feel comfortable talking to families, or when we do our domestic violence screening, really making sure that they're aware of how to properly assess a family so that they can provide additional supports to a family if they come back high risk with domestic violence.
Thanks, Stacey. And with our last answer, we'll toss it over to Claudia.
Thank you, Robert. So, awareness about domestic violence, and if I understand your question, it's a two-part question. One is awareness about domestic violence, and two, policy work that needs to be done right now. And so I would start with the awareness. COVID-19 has actually has increased the awareness about domestic violence being an epidemic in this country and in New Mexico in particular. So the awareness is there, but it's there now during this crisis. What can we do to really make a long-term impact to start moving the needle and decreasing domestic violence in our country and in our state? And what Enlace has been doing is a lot of reflection and studying what has worked in other parts of the world in terms of decreasing domestic violence. And what we are convinced is that domestic violence would never end if we don't change social norms that tolerate domestic violence in the first place. So we want to work with all our partners at the state, local, and federal level, but also our nonprofit partners, to start thinking about creating a mass media campaign similar to the DWI campaigns, similar to the tobacco cessation campaigns that have been proven effective. It's a long-term approach to this, where through all sorts of different communication methods, people start understanding that for women have to be increased, that domestic violence affects our children, that for the sake of our children, this has to end, and start really invading our mediums with these campaigns where we chain people that are perpetrators of abuse, and we encourage people to be to have healthy relationships in their lives, to value nonviolent behavior. So that's in terms of awareness. In terms of policy, we have been working on policies at the state level, trying to get the governor's office to make sure that EMSA, the Emergency Medical Services for Aliens, is revived. That is for those of you that are not so familiar with immigrant issues, EMSA has been the only way for immigrants, undocumented immigrants, to tap into emergency medical services and being able for EMSA to cover those emergency services. That's a federal law, unfortunately, but the states have the possibility of using their own funds, some of their own state funding, to cover some of the EMSA expenses. And so we have, with the leadership of the New Mexico Center for Law and Poverty and many other agencies that are pro-immigrant around the state, we have been having conversations with the governor's office to see if the state of New Mexico could cover some of the expenses related to COVID-19 for immigrant victims. Even though the state continues to say that the testing is free, in reality it's not free for immigrant families, that most of them do not have health insurance and again don't qualify for regular Medicaid. And so the only avenue is to expand EMSA and allow the COVID test to be covered with state dollars and the COVID treatment to be covered with that. The other thing is at the national level, another policy that we are fighting for is to make sure that the next, if there is a next wave of stimulus monies, that mixed status families, meaning those families where there is an undocumented immigrant and a citizen or a green card holder and 3 or 4 children that are citizens, that they don't get penalized. Right now, the stimulus money won't get to any, not just undocumented immigrants, but to any household, one person that is undocumented and is using the ITIN, the individual tax identification number to file taxes. If there is one ITIN filer in a family, the entire family doesn't get any of the stimulus. And so that for me is penalizing immigrant immigrant families and citizen children. And I think that needs to end. So at the national level, we are trying to push this policy and hopefully we get some results. We are not very hopeful, but we are continue to fight for this.
Thanks, Claudia. I appreciate that. There's a lot of things I didn't even realize as we're talking. So thank you. I learned a lot just from that last bit. I really appreciate everyone as panelists today. So it's 10:01. I know we're a little over time today. So I really want to say thank you to all of our panelists, Stacey, Michele, and Claudia. Thank you just for sharing your stories today and for all of your work in our community. Thank you so much for all you do. Thank you to all of our teammates, Mariah, Aaron, Juan is here, Michael, Destiny, and Jamie. I know they're amazing folks. They do amazing work every week. So we really appreciate all of their work making Impact and Coffee happen every single, well, not every single week, but almost every single week. So we return to Impact and Coffee next Tuesday on the 12th at 9 a.m. And we should have the recording of this video up towards the end of this week, along with an announcement for next week's speakers on our email and Facebook. So keep an eye out for that. Yeah, Mariah, do you have anything to add before we close?
I'd remind you to check out Giving Tuesday information if you're interested in that and you want to still share anything. There's time for that. Thank you, Larry. And I would remind you that we'll post some of the resources that were posted in the chat. If you're not an Albuquerque Involved member, you can vote once you get added. And yeah, next week our theme is going to be education. So lots more to talk about. And thank you, Robert. Thank you, team.
Awesome. And also, if you are a member of our Facebook group, ABQ Impactors, you can also post your events in that Facebook group as well, so that we can highlight what the work that you're doing in our communities too. So thank you, everyone. It's really great to see so many familiar faces on the line today. Have a really great Tuesday, and may all your lights be green. We'll see you soon.